Welcome to the third PRA seminar series of 2019-2020. I'm delighted to introduce Dr. David Lee, who's a reader at Manchester Metropolitan University. Dave's background is in epidemiology, and his academic interest focuses on how multiple biological, psychological and social problems conspire to erode later life, quality of life and well-being. Human sexuality and intimacy is an important aspect of this, and his current research focuses on how older people prioritise sexual health and the impacts of caring, intimate relationships throughout the life course. Dave's presentation today is titled Sex and Intimacy in Later Life, Challenges for Research and Practice, and his overview of the talk will look at the extensive data collected on sex and intimacy in later life from the ongoing English longitudinal study of aging, ELSA, how this data are now being used as an evidence base to inform the development of age-appropriate sexual health services in the Greater Manchester area, which will be discussed shortly. Thank you, Dave.
Okay, thank you, Hannah, for that kind introduction. I just wanted to talk today a little bit about, I guess, bridging the gap between more basic academic research and how I actually get some of that or those findings into the public domain in a meaningful way, i.e. to change policy and practice. So that's what I'm going to try and cover quite quickly today. So how did I get involved with this research originally? Well, if we think about sexual expression and aging, we all know that populations generally are growing older, but older adults tend to be healthier and have had longer, healthier lives. Now, what's been lacking over the last decade or so really is good quality representative data and statistics on later life sex and sexuality. So it's been difficult for us as researchers and as practitioners to draw conclusions about the relative importance of sexual relationships in later life. So the question I had when I began this research a number of years ago is, well, when we consider healthy or positive or successful aging, however you want to define that, how does sex play a part in maintaining that in later life? So I would argue that research into later life sexuality is of key importance because we're quite unique as a species of having sex not only for reproduction, but also for pleasure, love and happiness. So positive sexual relationships are indeed linked to a whole range of beneficial health outcomes. But we do need good evidence to provide information and reassurance for older people around relationships, specifically sexual, intimate relationships in later life. And this, I would argue, is making that strong case for a life course approach to sexual health and intimate relationships. So the key sort of overarching idea here is how can we possibly understand later life health and well-being if we simply ignore and don't take into consideration the place of sex and intimacy? So putting it in a broader context, a social context, when you think of the third age of this healthy, wealthy and engaged sector of society, that these people are post-retirement, post-parenting, pre-dependency, so they've got a lot of spare free time to enjoy their lives in terms of contributions to society, voluntary community activities, political, civic engagement, etc. And they're consuming and enjoying life, leisure, pleasure, cultural mainstream, having a role, status, fun, etc. But there's a cultural change in the sense they are liberated from the standardized lives of previous generations. And they're achieving sexual maturity at a time of the sexual liberation of the 60s, which is quite a very, social upheaval in terms of sexual norms and sexual behaviors. Or, of course, the other side of the coin, we can perceive them as greedy, self-interested baby boomers who have benefited more than most from very generous social welfare and are living very individual lives orientated purely to self-satisfaction. So there's a context there which has sort of opposing ends, if you like. So moving on to our research evidence, well, I've worked with a study called the English Longitudinal Study of Aging for a number of years, and with an Age UK fellowship, I was responsible for leading the inclusion of a detailed sexual relationships and activities questionnaire into that survey back in 2013, and again that was wave 6, and about 4 years later for wave 8. I'll say a little bit more about that instrument now. So it was included in wave 6 and 8 of ELSA, and ELSA as a survey has really rich data on a whole host of different things which are of relevance to the over 50s. So sorry, I should have said ELSA is surveying people over the age of 50 living in their own homes in England. So it's collected data on a whole range of health measures, cognitive measures, socioeconomic measures, and so on and so forth. It's all publicly available. You can go to the ELSA website and have a look at what they've collected over the years. Now, the Sexual Relations and Activities Questionnaire was actually completed by around 7,000 people in wave 6 of around 10,000 people who took part then. So we had about a 70% response rate, which we were very happy with that. So I just want to show some of the key headline findings from that survey, because one of the key questions we asked was, well, what do older people think about the importance of sex and sexual relations in later life? So this was one of the questions. It simply asked, satisfactory sexual relations are essential to the maintenance of a long-term relationship. And then they were asked, do you agree, don't agree or disagree, or do you disagree? And basically you can see from the left panel for men and the right panel for women, the green bars showing for different age groups on the x-axis there, that the vast majority of older people perceive that satisfactory sexual relationships were an important part to the maintenance of a long-term relationship. So obviously older people are perceiving intimacy and sex as an important part of their general lives. In terms of more headline sort of outcomes, talking about sexual desire and sexual intercourse, for example. So the bars on the the left panel, the blue are for men, the red are for women. And this is the same for the following slide as well. So we asked them, how often do you think about sex? Because it's a surrogate measure of sexual desire. So on the x-axis, you've got age ranges from 50 to 59, 60 to 69, and so on. And then we asked them on the y-axis there, so 2 or 3 times per month or more. And I guess we define that as thinking about sex frequently, because for some people that may be very infrequent, for some people that may be very frequent. We had to make a cut point somewhere. And you can see as people grow older, they reported thinking about sex less often, but consistently men reported thinking more about sex than women. So this sort of backs up previous research. So it gave us some confidence in the validity of the data we've been collecting over the period of time. On the right-hand graphic, it simply shows the frequency of sexual intercourse among those sexually active in the past year. Again, with the same age bands, men are in blue, women are in red. And there was a decline in frequency of sexual intercourse for all age groups as they grew older, for both men and women. And they were pretty much the same, actually. And so that sort of, again, gave us validity that the reporting, self-reporting on this particular questionnaire was valid and believable. Of course, the other side of the coin is, well, how do sexual problems change as people grow older? So again, on the left-hand panel, the sexual problems for men in blue were erectile difficulty to attain an erection, and for women in red, ability to become sexually aroused. For men, there was a very marked age increase. So as they grew older, the prevalence of erectile dysfunction increased from less than 10% in the 50 to 59 group up to something over around 70% in the 18 over group. For women, there's less of an obvious age increase in problems around the ability to become sexually aroused, and if anything, it dropped off in the older age group as well. But then the other side of the coin here, of course, is, well, you can have a sexual problem, but if you're not concerned about it, is it an issue which warrants any medical intervention, for example? Well, for men, it does seem to be an issue, because as the age has increased, then the proportion of men who reported they were concerned about erectile dysfunction or their erectile dysfunction increased from less than 10% up to around a quarter of the men. Interestingly, for women, there was no age trend in terms of the being concerned about the ability to become sexually aroused. It was around or just under 10%. So I'm not going to go any more detail now about the individual studies which have come out from the Sexual Relations and Activities Questionnaire. They're too numerous to summarize quickly here. So this is a very brief summary of the published findings. This is all from the cross-sectional findings from ELSA, mainly from wave 6. So just some examples here, we've found that better sexual health is strongly linked to higher cognitive function in ELSA. There are strong socio-demographic correlates of the number of lifetime sexual partners, for example, sleep problems and duration associated with sexual function as well. So there's a very diverse range of associations between sexual health and a whole host of different measurable health outcomes. In terms of the prospective findings, now we can compare the same people as they move from wave 6 to wave 8. Again, these are some of the key findings here. Positive association between sex and subjective well-being, happiness, which is important. Binge drinking positively associated with sexual activity, higher levels of sexual activity. So these are all documented on the ELSA website. So if anyone's interested, by all means have a look at what has been published from this very valuable resource embedded in the ELSA study. I'm also interested in the international context of this research, because not only is cross-national harmonized data on sexual health essentially absent in longitudinal aging studies, but very little, if any, research has been undertaken in low and middle income countries. So it's all been predicated on high income countries, particularly in Europe and North America. And also it hasn't been carried out in settings where there are older age sexuality remains a taboo subject. And I would argue that the analysis of the sexual health data from ELSA thus far demonstrates the value of extending these instruments to other national and social contexts. So I've been involved with the principal investigators of a number of the health and retirement studies. So this is the health and retirement studies, the study in the US, which all of these sister studies around the world are based upon, ELSA being one of them. And they have expressed an interest in developing country-specific sexual relations and activities questionnaires. So the studies, for example, is Lassie in India, Charles in China, Halsey in South Africa. So I've had these sexual health questionnaires translated into each of these local languages, and country-specific templates have now been distributed for initial assessment in those particular national contexts. So this is just an example of the South African translation, for example, and the Chinese, the Mandarin version behind there as well. So what we need to assess now is the best mode of delivery. Thinking about ELSA in England, literacy rates are pretty good in the subjects. That may not be the case in some parts, for example, of rural India. So we're thinking about delivery now for asking these questions around computer-assisted or computer self-completion questionnaire instruments as well. So that's ongoing in terms of broadening out this national research into an international field. And I think there's big research opportunities here, because the panel studies based on the health and retirement study, they continue to collect harmonized data across different nations, but not on sex. They've purely ignored that thus far. And I think having harmonized data, we have a real good opportunity, unique opportunity here, to think about transitions in health and sexuality, how they intersect in later life in different social contexts, and identify how different cultural perspectives may be linked or explain inequalities in sexual health and sexual well-being. So that's going to be very different in these very different national contexts. So that's research ongoing, which I think will pay very valuable dividends going forward. Okay, let's think smaller. Let's think about the local context. So I talked at the beginning about trying to get our research findings from the academic field into something more usable, which can influence policy and practice. So I'm going to talk about the local context in terms of Greater Manchester and improving or trying to improve sexual healthcare services for older people. I just wanted to acknowledge Christine Camacho, who's a public health registrar at Manchester City Council and an honorary research fellow at the University of Manchester. She was involved integrally with this work as well from the public health perspective. So there's just a map of the 10 authorities which make up Greater Manchester. Now, Greater Manchester is an interesting case, I think, here, because quite recently, the health and social care agenda was essentially devolved to the city region to be run locally and not from the national level from Westminster. So there's a lot of local control and potentially changes in terms which could influence policy and practice which could occur within the Greater Manchester region. Let's think about something a little bit different now. And this is working with Christine, the public health data here. The epidemiology of sexually transmitted infections in England between 2015 and 2018. There are few papers in this area, but there are indications of an increasing incidence among certain age groups. So the data come from the GUM CAD system collated by Public Health England. It's all aggregated and anonymized, but it is available, interestingly, at the local authority level. So we can model future incidence of STIs in older people, and also think about health economic modelling as well going forward. So this is just a snapshot of the epidemiology of STIs in England between 2015 and 2018. If you're not into statistics, don't worry about what the incident rate ratio means. The interesting thing is the only increase has been amongst the 45 to 64-year-old group. So that encapsulates some of the baby boomers and the people transitioning through retirement. A lot of the folks we're interested in, for example, in ELSA. So all the other age groups, the actual diagnosis of new STI diagnoses actually weren't significantly changing, apart from the younger age group, well, in fairness to 15 to 19, but they make up the bulk of the 16 to 24-year-old group, make up the bulk of the burden for sexually transmitted infections in England. This was just a little graphic we put together, actually, looking at the potential number of STI diagnoses across the entire local authority regions in England. So it's a little bit quick, I apologize, but you can probably pause this actually on the actual play. And it just enables us to model projections of STI diagnosis in people over 45 going forward from 2015, then projecting all the way forward to 2038. The key take home, some of the major urban and deprived regions, London, Southampton there, Brighton, Blackpool, Manchester, Salford, particularly in that age group we're interested in, and particularly interestingly amongst men who have sex with men, there is a big increase in diagnoses, particularly amongst gonorrhea as well. So this has marked implications for the changing demographic balance of STIs in the future. Okay, so that was just a little snapshot of the disease side of the STI, the public health side. Coming back to ELSA, well, how are we going to try and tie in the evidence-based from ELSA to what we're finding from the public health information about STIs, for example? Well, we know that from ELSA that older people remain sexually active, and declining general health and sexual health are closely linked, particularly amongst men more so than women. And a range of sexual problems are indeed associated with poorer subjective well-being and happiness. But interestingly, and we've got these data from ELSA, is less than a fifth of older adults who reported they were concerned about their sex life in some form or other actually went out and sought any help or advice about it. So the question we had is, well, can we use some of these background evidence and findings? Can we improve the experiences of older people seeking more holistic sexual health care within the Greater Manchester City region? Interestingly, at the end of the ELSA sexual health questionnaire, there was an open text box. So, and basically all it said is, if there's anything else you'd like to tell us, please write in the space below. We should be very interested to read what you have to say. Now, these really haven't been utilised in a lot of ELSA questionnaires in the past, but we were quite interested in trying to extract some of that qualitative data, because over 1,000 people in Wave 6 left additional information, more women than men, but there was a significant number of comments, some quite detailed and in depth. It feeds into really what we're trying to do in Manchester, in developing what we call the big conversation, which is to change societal attitudes to later life sexuality. And this has been based upon a number of publicity campaigns I'll touch upon in a second. But also then working with this small conversation we called, and that's more specifically working with healthcare professionals within Greater Manchester to try and improve the delivery of sexual health services for older people. So not just thinking about disease, but thinking about supporting more holistically the sexual health of older people. So these were just some of the examples of the quotes which came from that narrative box at the end of the ELSA sexual health questionnaire. So we were using some of these to inform our ideas about a social media campaign to try and move societal norms and stereotypes about late life sexuality away from humour and disgust, but something which is more perceived as normal. So these are just some of the examples. I'm not going to read them all, but for example, the second one from a lady, 50 to 59 years, sexual activity for over 50s seems to be a taboo subject amongst old and young alike. So it speaks to that intergenerational differences and ageism around stereotypes around sexuality. And there's also a gentleman there, the third one, age should be no barrier to sexual enjoyment. However, stress from everyday life living can impact at any age. So it's reflecting on, the realities of the lived experience in terms of sex and intimacy as people grow older. So what we've used, and we've run this campaign on Valentine's Day last year and also this year, was to take some of those quotes and have public meetings with some older persons groups within Greater Manchester to discuss how they perceive society would look at their own sex and intimacy. And these were just some of the quotes which are coming out from older people in Greater Manchester in terms of trying to break down some of those stereotypes and taboos. So, for example, a lot of talk around the menopause doesn't have to be the end of sex and sexuality, but people being very happy and content with their own perceived appearances. So I'm older, bold, and happy in my own skin. In terms of the more informative quotes for our research to try and change healthcare in Greater Manchester, these were some of the examples, again, from ELSA, the First Lady there, 60 to 69, reporting that when she sort of contacted the NHS, they were reluctant to help with sexual problems, and that she was simply advised is due to age, again, reflecting that age's take on sex and intimacy in later life. And there's a gentleman there, the second one, doctors and healthcare professionals do not, or he perceived that they did not seem to give any help in terms of his own sexual health problems, in terms of his example, erectile dysfunction. So we were able to take a lot of these ELSA quotes, again, from public meetings and work with healthcare professionals in Greater Manchester to show them what older people were saying. And then hold meetings with them to say, well, actually, how can we change and improve the delivery of sexual health care services in Manchester for older people? So we've done two things here. We've also put together a nice quality standard, which has now been taken on board to reflect that older people are entitled to good sexual health care and sexual health care services. We've also held a workshop here in Manchester last October with healthcare professionals, and some of the feedback there, people were saying, well, they'll update their work that has been done after this session and great information and so on. So we had very positive feedback from healthcare professionals about the need to change and improve services for older people with respect to sexual health. We're also engaging with other forums within Manchester, the Practice Nurse Forum, and engagement with the Manchester local care organisations as well. So what we're doing now is putting together a feasibility study to develop an intervention based on some of the evidence base from ELSA, and also talking to older people and healthcare professionals within Manchester. So a feasibility study to develop an intervention for use in primary care, so these will be in GPs' practices, to raise awareness of the sexual health and wellbeing needs of older people. So we simply want to improve the quality and accessibility and the normality, if you like, of sexual health care for older people. So we'll be working with older people and healthcare professionals in the GM region to co-produce an intervention for use in primary care. So this is now going forward. We're working with GP practices and a small number of practices to look at feasibility studies. And obviously then there's the perennial problems of getting some funding, but we'll hopefully put some funding in for the Health Foundation and maybe a fellowship to the NHR to take this forward. Another thing we're interested in doing, and I guess there's always a movement to do this within epidemiological research, is to shorten the instruments we use. The questionnaire in ELSA has around 30 to 35 questions, so it's, it doesn't take so long to complete the questionnaire in the context of the larger ELSA survey. But if we can capture key parts of that information in a shorter instrument, that's always a good thing. So we're trying now to develop what we call a sexual experiences and health questionnaire, short form, also known as a SEX7, for the example of this particular presentation. It may end up with 8, 9, or 6 questions, who knows? So we need to get that validated going forward. But the key aim is we're trying to learn more about older people's experiences and use this again to shape service delivery going forward. The questionnaire has been tested as part of the Valentine's campaign this year, so there's an online version for people to fill in. We're going to formally validate the questionnaire to see what the best instrument we can develop, and it will be interesting that it potentially could be used in other surveys within not just the national context, but in translation across international contexts as well. So these are the questions we included on the online version. There's a link on the bottom there if anyone's interested in having a look. It's not just aimed at Greater Manchester residents, although we were most interested in that population initially, but certainly for validation and sort of seeing how well this particular questionnaire performs, we'll be interested in, and other people filling this in as well. I'll leave that slide there. Just have a quick look. You can see what the key questions we're trying to capture. Okay. I'd just like to acknowledge the whole host of different institutions and individuals involved which helped with this research, not just the universities, but obviously the local Greater Manchester city councils and also the other borough organisations as well. Obviously the ELSA survey itself and Age Friendly Manchester as well. Okay, thank you very much. There's more information around the ELSA survey in the links on this last slide, but if there's any questions, then I'll take them now.
That's great, Dave. Thank you very much. And what a fascinating presentation. I have 3 questions for you. And the first one is, what are the pros and cons to research in your area?
You're thinking what sort of challenges and enablers in terms of that, Hannah, yeah? I think if we think of epidemiology broadly, because I was still badge myself as an epidemiologist, I think is getting cross-disciplinary working to actually work well. I think as researchers, we work well at the individual level with one another. People are typically very keen to share ideas, share research, and try and develop projects together. The downside of that, or not the downside perhaps, but the potential barriers I think there are institutional structures not perhaps working so well. So it tends to end up in researchers working perhaps in more siloed environments than would be necessary. So I think that's a barrier. I guess that's not unique just to epidemiology. Many areas of research would come across those type of barriers as well. I suppose in terms of the enablers, and this may sound like just I'm taking the other side of the coin here, but it is trying to work with people across those silos and trying to work around those sort of institutional or faculty or structural barriers as researchers, but perhaps more broadly, and I think this research is showing that, is being willing to work outside of the university fold and try and get research out there into the real world, and I think that's the key thing really to make an impact in terms of what we try and do as researchers within the university sector.
And I think with your presentation just now, your research is showing that it is being impactful, especially with the health practitioners and changing their perceptions and maybe their ways of working with older people and relating to their sex and intimacy issues and concerns. Absolutely,
and I hope that continues going forward. In terms of, we have had very positive responses, and I think it's opening. I think people know the problems, but it's just giving that additional nudge perhaps to say, okay, actually, yes, we can perhaps begin to do things about this and move things forward for the better.
Definitely. Question 2 is, what has been your biggest challenge or challenges in your research to date?
Okay, thinking about this particular piece of work, or the ELSA sexual health work, I think it was initially convincing people of its worth. Now that's not just, well, it's on 2 levels there, I suppose. It's people involved, for example, in the ELSA survey, maybe some of the senior principal investigators, for example. No criticism here, but people were slightly twitchy about, well, why do you want to ask about sexual health in the over 50s? There was even a thinking amongst some people that it's not really relevant. Some of the earlier sex surveys would only survey people up to the age of 50, thinking, well, the questions aren't really relevant when you're in your 60s and 70s. So I think it was breaking down those initial barriers. And there was a certain reticence that it may put people off taking part in ELSA, but actually we've seen from some of the narrative output, some comments at the end of the sexual health questionnaire, people saying, well done, ELSA, it's about time these questions were asked. But I think it's also trying to sort of prevent the broader societal narrative around this work from becoming too subsumed by pre-existing stereotypes of older age. We're trying to keep not control of the narrative, but it's trying to keep a balanced output in terms of particularly press involvement. You start talking about sex in later life, sex in older age, the stereotypes come back to the surface in terms of humour, disgust, so older people don't do it. So there's that constant sort of pushback to try and keep a sensible narrative going forward.
And do you think within the research team and the community, those that now complete ELSA, do you think the perception has changed about including questions relating to sex and intimacy?
I'd say amongst most people, yeah. Not everybody. I'm not going to mention any names, but I'm sure there's some individuals who will always, perceive their own areas of research as key and central. But anyway, that's another story, I suppose. But no, I mean, I think broadly speaking, most people are fairly accepting on the value of understanding the place of sex and intimacy in later life.
Fantastic. And my third and final question is, what improvements would you like to see in your research or changes? Yeah,
it's a good question, Hannah. I mean, I think the key thing, and it comes back to what I've spoken about already, I suppose, sorry to sort of reiterate the point, but I think if you think of epidemiology and population health, we have been very, very good at researching and understanding the minutiae, if you like, of health and disease and the predictors of health and disease, almost to the point of over understanding some problems in the population level. What we've been less good at, I think, is getting or translating those research findings into the real world so that they actively change health policy and practice. And it's quite topical that the Marmot report came out today in terms of social inequalities in health. And, some social inequalities have widened over the last 10 years. And unsurprisingly, those in the most deprived areas have lower life expectancy, and it's going down. No, it's not heading the other way. So we already know the answers to many of the drivers of poor health, and sexual health being one of these things as well. So I think it's just getting that research information more effectively into domains where it can change policy and practice. I mean, that's the key thing for me.
And before we end this seminar today, is there anything else that you would like to add to comment on?
Not specifically, I don't think. No, I mean, I just say it's interesting in the local sort of take of what we're doing in Greater Manchester. Keep an eye on what the city does, actually, because it'll be quite interesting that the different universities and other institutions hopefully working together. Maybe we'll see some good practice coming out from a more sort of microcosm, if you like, of a city region, to see if we can actually change health policy and practice in a more efficient way. Manchester has its problems. It has some of the most deprived wards in the UK. So I'm not underestimating the health issues more generally within the region. But it's an interesting natural experiment going forward to see how that actually transpires for better outcomes for people in the future.
And maybe if it can be rolled out across the Greater Manchester area, then it can be also tested and rolled out across other northern cities as well with similar issues.
Absolutely. Yeah. I think the structures that make it slightly easier at one level currently in Greater Manchester, but you're quite right. I mean, if there are very positive, and hopefully there will be positive findings, that they can be rolled out more generally nationally as well.
That's great. Dave, again, thank you very much for this fantastic presentation, and it will be uploaded to our YouTube channel in the next week or so, and your contact details and your Twitter handle will be available. So if anybody who watches this presentation wishes to contact Dave directly, you will be able to find his email address and his Twitter handle. Thank you very much, Dave.